So IPAN is a large team of multidisciplinary, internationally renowned researchers who focus on understanding and influencing physical activity and nutrition in the population.
My research focuses on obesity preventive behaviours in children, so primarily physical activity and sedentary behaviour with a focus on the early years, so children under the age of 5. We know that behaviours are hard to change later on, and really my research aims to help parents to provide their children with a good start to life.
Prevention is my passion, and if you look at where disease comes from across our life, we can feed back a lot of that to what happened to us in utero when we were babies and across the first 5 years of life. What happened to us in terms of our diet in that time seems to be critically important. So if we want to prevent lifestyle diseases like overweight and obesity, cardiovascular disease, lots of cancers, then we need to be looking at what's happening in the beginning of life.
We know that our eating and our activity patterns are important for health and well-being. A lot of people don't realise how important they are in terms of people's risk of diseases like heart disease and cancer. We span everything from nutrition across physical activity, and we have people who work in the laboratory setting, in the clinical setting, and also more broadly in the community.
So here at IPAN, we're not just interested in whether or not exercise and nutritional interventions have a benefit for health, but also looking at the molecular level in the lab to see really how these interventions can improve adult health.
We know over the next 30 or 40 years that 25% of the Australian population will be aged over 65, and most will have one or more common chronic diseases. And we know that many of these diseases are lifestyle-related diseases, which physical activity or inactivity and diet play a key role. So we're trying to look at targeted approaches which specifically are focused on people with a disease or risk factors for diseases so they can get the best benefits.
Working with our stakeholders is really important to tackle these chronic disease epidemics that we're seeing in Australia and globally.
The relationship we have with IPAN is critical for the work that we do, not only as an institute, but also the individual researchers that are within the institute.
So IPAN has a major focus on prevention of chronic disease through promotion of physical activity and nutrition. And a major focus for us is bringing on the next generation of research stars in physical activity and nutrition in Australia.
So EMCR stands for Early and Mid-Career Researchers, and IPAN's EMCR program aims to provide professional development, support and opportunities to the large contingent of our researchers who are at early or middle stages of their careers. These people represent our next generation of researchers, and it's critical that we support them to be outstanding scientists and research leaders.
Research is an investment in our future. The work we do at IPAN informs health policy and programs and has the potential to impact on community health and wellbeing.